In other news this morning, Health E-News has developed a survivor support service that provides a directory of all Thuthuzela Care Centres, hospitals, 24-hour clinics and shelters for survivors of rape, and that's across the country. This is part of the Izwi Lami, that's my voice campaign, to ensure rape survivors get the medical services and support they need. Well, to tell us more, we're joined in our studio this morning by Kim Harrisburg, a multimedia journalist at Health E-News. Kim, good morning, and thank you very much for coming in this morning. Just what led to this this service? What really made it happen?
So Health E-News is a health reporting service, and we've been reporting on rape for many, many years in the country. And we realized that we needed to provide survivors with information where they could access services that could potentially save their lives after being raped. So we looked at a study done by Doctors Without Borders in Rustenburg, which showed that 95% of rape survivors did not access or did not seek healthcare services after being raped. So we developed a mobile phone service. It's free, it's anonymous. Survivors need to dial *134 *334#, and they get sent a list of shelters, clinics, Thuthuzela centres, 24-hour hospitals, so that they can access care that they might need after being raped.
You say this is free, so you don't need data for it?
No, any mobile phone, smartphone, feature phone. It's an interactive tool that asks them which language they would like to use a service in, where they are located, and what service they would need.
When was this launched, and how is it going?
So it was launched officially about a year ago. We started off as an SMS tool, but South Africans prefer USSD service. So we've seen that since we transitioned to USSD, we've had nearly 1,500 users in a short space of time, which shows that the service is needed.
Okay, what kind of information sits in that service?
So when the survivor will dial that number, they'll be asked 3 questions. Which language would you like to access this in? Where are you based? And what service do you need? And by service we mean healthcare services. And that'll be sent to them. It'll be the address, the number of the place that they are seeking to go. And we are hoping to inform survivors also on this tool about their healthcare rights once they have been raped.
Now, the Izwi Lami, that's my voice campaign. This is part of that bigger campaign,
yes.
And you've rolled it out for quite some time.
Yes.
Do you find that the people who've been using it currently, those you said the numbers are growing since you did the USSD service, do you find that they really find it's helping them? I mean, does it really get them the help that they need at that time?
Yes, I think, it's always good and bad news when we see that it's being used, because it does show that there are many rape survivors that need the service. But, survivors don't always know that they are entitled to antiretrovirals, to the morning after pill, to tetanus shots, to counselling. So we are getting good feedback from people that are going into healthcare services and asking for these things. Yeah,
besides talking to other media houses like ourselves about this service, how else are you spreading its awareness to make sure that across the country, because we are dealing with a scourge of rape, I mean, that's our reality, sadly, tragically, as a country, are you making sure they become more and more aware of it?
So we've printed thousands of posters in an array of languages. We have citizen journalists across the country who are helping us distribute these. We've got stickers. I've put them on my car. We are going on radio shows, television shows. We are trying to promote this as much as possible, and working with communities, with community radio stations, because we know that this is a need in the country, unfortunately.
Yeah, and so you said the USSD is accessed by dialing *134 *334#.
Correct.
And that's how people can be doing. And is it anonymous? I'm asking this question because we've just seen the scenes in the Timothy Omotoso case with Cheryl Zondi being grilled by a lawyer, cross-examined, even sometimes asking questions that get the court gasping. People now are taking to social media to express sympathy and support for her, and sometimes rape survivors tend to shy away. So is this anonymous?
Yes, it's completely anonymous. It's completely free. We salute women like Cheryl who have been so brave to come forward with her testimony, but we know that some women also want that privacy and that anonymity. And this service, you can access it anywhere. It's accessible in different languages, but we want survivors to know that if they need to just have, in the privacy of their home, to receive a list of services. You know, we have Thuthuzela Centres in the country, which is specifically catering to rape survivors, and that's fantastic, but there's only 55 of them in the country. Maybe they're under-resourced. Maybe a woman in a rural area is too far away from there. So we want them to know that they can access Thuthuzela, shelters, clinics, hospitals, and give them their rights. They know what they are entitled to ask for, because unfortunately a lot of women don't know that.
Okay, no, thank you very much, Kim. And well done to Health News. And hopefully this service will really help a lot of rape survivors. That's Kim Harrisberg, a multimedia journalist at Health E News.